All right, March, Colon Cancer Awareness Month. The disease is the third most common cancer worldwide and affects both men and women.
That's right. Joining us now is Dr. Joan Culpepper-Morgan from New York City Health Hospitals to shed some light on the importance of screening, early detection, and prevention. So, Doctor, great to have you here.
Thank you.
Talk about this, right? And let's begin with something we often hear, which is that early detection saves lives, right? So what can be detected from screenings, and more importantly, what's the right age to go get it?
So it's absolutely true that early detection saves lives, because the earlier we can diagnose a cancer, the easier it is and the better we are at treating it. Late detection, late stages of cancer, not treated as well, and the treatment is fairly onerous, sometimes actually painful. So we like to get there early and actually diagnose what we call precancerous lesions or polyps.
Yep.
So when we do screening, that's what we're looking for. We're looking to get there before the polyp actually turns into a cancer.
Yeah, what are the different types of screening then for colon cancer?
So the best screening is colonoscopy, and the reason why I say it's the best is it's one-stop shopping.
Yep.
You go in, you see the lesion, you remove it, and your risk from cancer goes back down to zero. The other methods are what we call two-step methods, and they're usually stool tests. So they either test for blood or the DNA of the cancer in the stool. If you see that, or if it's detected, then that person has to still undergo a colonoscopy.
Yeah.
But it's sort of like, I think it's a pre-step to having a colonoscopy.
So what's the right age to go get that first colonoscopy?
So the right age now is down to 45. It used to be 50.
Yep.
Because most cancers formed at age 60. And we know colon cancer development very well. We know it takes 10 years to make a cancer.
Wow.
So, but now that age is shifting downwards.
Okay.
Yeah.
And so we're screening now. Everyone average risk is considered age 45.
And you know, I know a lot of people are intimidated by the thought of a colonoscopy. I had my very first one this year, and it's not as bad as people think, and I'm just so relieved that I went. So, just so folks know.
Right.
What are the risk factors, though?
So the risk factors for developing colon cancer are to be male. It's higher in African Americans and Native Americans. And I think that most of those sort of demographic distinctions have to do with the socioeconomic conditions that both of those groups find themselves in. But also obesity. Obesity is a risk for most cancers, and it is especially a risk for colon cancer.
And we have been hearing about, I guess, this rising number of cases in younger adults, right? And you kind of alluded to that. But why did the age drop to 45? Was it just because it took the 10-year period, or are you actually seeing more and more cases in younger groups? We
actually are seeing an alarming rate of increase in colon cancer in younger groups.
Why?
And we do think that that's because we have we have a full decade now or more of people who have grown up with bad diets and moving less.
Yep.
So as a society, we're eating more processed foods. We're eating more foods that contain high fructose corn syrup, which as a single agent has been found most connected with developing these cancers. So now you have a whole generation of young people who were born in the 80s, who are coming into their 30s, who have had nothing but these diets and who have been very inactive and who are more obese.
Well, we've run out of time, but I just want to quickly ask you, what is your best advice then for colon health?
Best advice, eat a lot of fruits and vegetables, move your body. Try to avoid obesity. Do whatever your doctor tells you that you have to do in order to do that. Don't smoke. Okay. Alcohol in moderation. It's the same diet and advice. It's good for everything.
That's right. Good advice indeed. Thank you for being here, Dr. Culpepper-Morgan, to raise the awareness of such an important issue.
Thank you for having me.